Hi, my name's Tina Seedhouse. I work at Portview Surgery in Saltash, and I've been asked to give you a little run through of the Alamac data entry system. Since the beginning of June, myself and David Shepherd from Rosedene have been entering data onto the Alamac system. It's data that we collect daily from our clinical systems about the appointments that are available for each day. So you look forward to the day ahead and see what availability you've got for appointments, and you also look back at the day that's just gone to see what your availability versus what your actual capacity was, what you actually did. So each day you enter the data onto the Alamac system. You also record home visits and whether they were urgent visits or routine visits, and you also record your DNAs. Now, I'm not going to lie, actually setting up the searches in your clinical system to collect this data can be a little bit tricky. No two appointment systems, as I'm sure you'll be aware, are the same. It really depends on each practice and how you classify your appointments, whether you classify them as urgent or routine or keep for the day appointments, however you do it. You've got to work out a way yourself of extracting the correct data from your system. But once you've done that, actually entering the data onto the Alamac system each day is really simple, really quick and easy, and it takes, I would estimate, no more than 5 minutes each day. The only thing that I can't extract from my system is a reason for a home visit, so I can't work out whether it's a routine or an urgent home visit that's been requested. So that's something that I manually have to check each day, but even doing that, it doesn't take me more than 5 minutes each day to do the recording. The pilot that we've been doing over in Plymouth hasn't particularly gone that well, because out of the 10 practices, only 3 of us were actually consistently entering the data. That's something they're working on now, and I think they're going back and historically filling in all the data requirements now, so that we will get a really good picture. We'll get a picture of how capacity and demand within primary care then has a knock-on effect to secondary care, and you can see a really good correlation between the two. When it's peaking and troughing in secondary care and the capacity and the demand is really bad in primary care as well, you get a really good picture of how the two systems affect each other and actually rely on each other to be working correctly in order to carry on. My clinical system is EMIS, and the way that I extract my data is through a system called, it's in the appointment system, and it's a reporting system called Appointment Report. And I've set up 7 searches that look at the capacity for tomorrow, the demand for yesterday, and they run automatically each morning. The data's just there waiting for me that I then collect and put onto the Alamac system. If anybody wants a little bit of advice or help in setting up those systems, I'm more than happy to help. However, I know nothing about microtests, so I can't help any of you with that. But I'm happy to give any pointers if anybody needs them within EMIS. I'm sure once you're all up and running, it'll all be fine. It doesn't take much of your day, as I said, and hopefully we'll generate some really good information that will help us moving forward. Thanks.